These are the types of heart failure: right-sided heart failure, left-sided heart failure, and there are two more types: systolic and diastolic heart failure. So first of all, we will talk about the right-sided heart failure. So what happens here? It affects the right ventricles. And then as you see, I specifically mentioned here peripheral edema. So now we talked about the blood circulation. So let's have a look at the right side of the heart. So what's there on the right side of the heart? There is deoxygenated blood, right? So when the right side of the heart is failing, it's not pumping the blood, what's going to happen? There is going to be backflow, right ventricle, it's not pumping the blood to the lungs. So what's going to happen? There's going to be backflow back to the right atrium, and then back to the superior inferior vena cava. And that's what's going to happen because of that. There's backflow of blood, and it's going back where? It's going back to the body, right? So that's why there is peripheral edema when there is right-sided heart failure. So now let's talk about the left-sided heart failure. So as we talked about the the blood circulation of the left side of the heart as well. So let's have a look at the left side. So as you see, what I have written here, it affects the left ventricle and it has effects on the lungs. So as we talked earlier, from the right ventricle, the blood goes to the lungs. So let's keep that in mind. From lungs, the blood comes back to the left side of the heart, that is left atrium and left ventricle. So when the left ventricle is not pumping the blood, what's going to happen? There is going to be backflow of the blood from left ventricle, left atrium, back to the lungs, right? So when there is that congestion, there is the backflow of the blood, then effect is going to be where? On lungs. So that's why in the left side of heart failure, there is effects on the lungs. You will see more crackles, the chest congestion, where on the right side of the heart failure, there is going to be peripheral edema. So let's talk about the other two types of the heart failure. So the systolic and the diastolic. So as you see, I have written the explanation here. So left ventricle cannot squeeze as strong as it should. So what happens as a result of that? There is reduced ejection fraction.